failure is not an option. Gene Kranz from NATO. Bring some words that is improve our our feeling, because we are planning to get the accreditation. So failure is not an option should be like our target these days. Okay. Actually, the next speaker will be myself, and there is no one to introduce me, so I will introduce myself. Okay.
Take your time.
Actually, today my talk will be a little bit different. So I have a question, and this question for myself and also for all of you. Are you confident enough in your research results? This is actually a very good question, and the answer may be easy, yes or no. However, I don't think the answer for this critical question will be so easy. Are you confident in your research results? Are you confident to get the job? This is what we will see in this talk. Let us see first what is the confident mean. Confident, having strong belief in terms of research, strong results, full assurance, I'm very sure about my results, having no uncertainty. This is the confidence. Which kind of research has no uncertainty level? No. So, it's very nice to see your face as a lion in the mirror, but not in research. In research, even you are confident, you have to see the actual, the true face, the true picture. Don't enlarge the things more than what is it. Okay? So, no need to be a lion. You have to see your actual face in the mirror. To be confident, but you need to be confident about research results. Maybe first, you have a good research strategy, which is okay. Strong background supporting your work. The number of samples. You just have results from 1 or 2 samples, or you have enough samples to be sure about your results. Guidelines. It's very important. When you have a guidelines, you follow the guidelines, you have acceptable results according to the guidelines. So I am confident. Of course, the guidelines include method validation. Be sure about your precision and accuracy, the test robustness, everything, all the terms of confidentiality will be in your research results. Do you think this long list is enough? Actually, for me, I'm still hungry. This is actually not enough to be confident of your research results. And this is why I want to share with you my experience in this field. You always have 2 ways. Which way you will select to go? I will talk today about matrix effect and liquid chromatography, tandem mass spectrometry. Why LCMS? LCMS is the method of choice for determination of either small and large molecules. And the word method of choice, not my expression. The worldwide say LCMS is the method of choice for determination. Why? Because it's a sensitivity. You can determine very, very small quantity. It's selectivity. You can distinguish between very complicated samples. You have a protein digester, for example, and you can just monitor your target type. So this is why it's method of choice. And it's applicable to both small molecules, like regular pharmaceutical compounds, and now for large molecules, like protein digest and peptides. So, what is the matrix effect? Matrix effect is the main problem in LCMS. Again, what is matrix effect? it's a signal enhancement or suppression. The results you have, the response you have from the instrument may be enhanced or suppressed due to matrix effect. This is when your analyte co-eluted with other endogenous components. The main cause of matrix effects are phospholipids and other lipids such as cholesterol, triglycerides. And you can imagine these components endogenously present in huge quantity in your sample. Even after extraction and cleanup, you still have huge amount. And if you have experience with mass spec see only the mass transition. So all these compounds are unseen. So you are searching for something like in dark. You do not know the compound, you cannot see it because it's not, mass spec is very selective, very specific. See whatever the mass transition you enter to the instrument. So I think it's a hard way to go with the matrix effect. The exact mechanism of matrix effect is still unknown till now, but most of researchers started to focus in this phenomenon. What actually matrix effect do? If you have your compound, your analyte, and you infuse your compound, you enter your compound to mass spec without column, without liquid chromatography, without separation, just directly by a syringe or of course automated syringe. So you're supposed to get like straight line like this one or this one. Okay? This is normal. However, presence of matrix effect will cause suppression or enhancement. So say if you have 100 nanogram in the patient sample, actually you will see only 1 nanogram. And this is of course not true. Or you have something like 50 nanogram here, you will see about 100, which is also not true. This is what matrix effect can cause in your results. So I will share with you some examples of how to be confident of your results. This is the first example, determination of two compounds, hydrocodone and pseudoephedrine in human plasma. For minimization of matrix effect, most of researchers developed different approaches. The first one, to compare different extraction procedures and select the one that will remove most of the lipids, endogenous lipids from your sample, of course. However, even this method remove like 90, 95, you still have about milligrams in your sample, which is huge in comparison to your analyte. The second approach, to use label internal standard. Like here, hydrocodone D3, which is very similar chemical structure, eluted at the same retention time almost, so it can track any changes happening to the response. Because you always calculate the ratio between the drug and internal standard. However, there is a little bit change in the retention time, even if it's labeled internal standard. The third approach, to adjust your chromatographic condition, so you separate the phospholipids or the main cause of matrix effect from your analytes. So what I did here, I did the three strategies. I compared different extraction procedures, select the most appropriate one, producing the least amount of lipids. Okay? I use the labeled internal standard. I adjust my chromatographic conditions, so I separate the lipids, monitor the lipids here. If I didn't add this mass transition, I will not see anything. So I monitor phospholipids, and then I separate them from my analytes. You can see excellent peak shape, everything looks very good, right? Confident enough? What do you think? I made everything according to the literature and background and everything. This is what usually all researchers do. This is not just my investigation. This is normal. So confident enough in these results? Actually, no. Because after many injections, not 1 or 2 or 50, after hundreds of injections, what happened? The elution time of phospholipid changed, and it's co-eluted with my analytes. And you can see here how the peak shape becomes very bad. Signal to noise becomes very low. The response becomes very low. Everything was very bad. As I said before, this is after hundreds of injections not 50, not 75, hundreds, about 200 or more. Why I have to wait for 100 or 200? The preliminary results were excellent, because when we develop methods and apply this method for the patient sample, we usually analyze hundreds and maybe thousands of samples. So it's not enough to just make your method, develop your method and apply for like 50 samples, it's okay, publish the results and that's it. No. If you return back and look at the big shape, and you go here, you can see the big difference between the results. Even the same column, same chromatographic conditions, everything was the same, only number of injections. So in this situation, usually a researcher monitor phospholipid at the first to remove it or to separate from your analyte and that's it. No, in this part of research, we advise, we have to monitor phospholipids in all sample analysis to be sure that you do not have any co-elution. And the column will have a limited time or limited number of injections. So this is kind of how you maybe follow everything, but you're still not confident about your results. A second problem. In this part of research, we determine chlorophenamine maliate in human plasma. We do not have a labeled internal standard because no company synthesized it at that time. We use diphenhydramine. Most of researchers use diphenhydramine as internal standard. The interesting thing here that is elution of phospholipid causing suppression for one analyte and the enhancement for the other one. We have about 100% ion enhancement for diphenhydramine. So if you have 1 nanogram, you will see it 100. And we have 70% suppression for chlorophenamine. Of course, the result will be just messy. Nothing will be correct. So this is another example of how monitoring phospholipids is very important during method development. Of course, we make many changes. We change the ion source to reduce matrix effect. We ask one of the companies to synthesize the labeled internal standard for chlorophenamine, and we repeat the results, which was much better. Another important problem, intersubject variability. Intersubject variability means when you develop a method, you use plasma sample, whatever the source, from 3-4 patients. However, if you apply the regular way, you apply your method to patient sample. They are different, of course. So you have to measure the intersubject variability. This part wasn't in the guidelines. The FDA guidelines didn't have any intersubject variability at that time. So I follow all the guidelines. All my results were acceptable. According to FDA guidelines, all my validation, my results were acceptable. However, when I did this experiment, I bring plasma sample from different patients, from different sources, and apply the method. The acceptable results is 20% only for the error. So I have some on the border. I have some very, very high, 39, 63. So according to guidelines, my method is valid. My method is okay. However, according to this experiment, it's not in the guidelines. This is not okay. So again, I modify the method. I change the ion source, make many modifications till I get acceptable results. The good thing is that is now FDA add this part of experiment to the guidelines. Now, in each researcher should check the intersubject variability. So, the newest thing in matrix effect and LCMS is the lipemic samples. Lipemia in bioanalysis for us mean samples containing high concentration of lipids. When I order the plasma, usually the manufacturer or the sample, the company collecting the plasma sample visualize the sample and of course exclude the lipemic sample. This is normal. So lipemia means the milky appearance of the plasma. Lipemia in bioanalysis looks like qualitative term because they said it's a lipemic sample, lipemia, not quantitative. I don't know how much lipids. It's only high lipid. And usually most of researchers exclude the lipemic sample during the research. So if I will order plasma, of course, if it's not clear and yellow like this one, I will exclude the lipemic sample. Because the lipemic sample will cause many problems, even in extraction, blocking the solid phase extraction and may lead to many problems. So the normal way, I will exclude the lipemic sample. What do you think? Is this right? So at this point, I have two ways to go. I have the easy way to get good plasma, that the results will be excellent, no problem. And the hard way to investigate the lipemic sample and see what it will produce. And I have to select actually the hard way. Because according to my background, my information from previous studies, I know that the extra lipid in the sample will cause matrix effect and will cause variations in the results. So it's not correct. Even though guidelines said you have to investigate the lipemic sample, till now, till today, there is no, in the FDA guidelines or other bioanalysis guidelines, said that you have to check one of the lipemic sample. So I tried the hard way. I ordered lipemic sample. Instead of exclude lipemic sample, I ordered 6 different lipemic plasma samples from different donors. So they were like 3 males, 3 female, the age ranging from 28 to I think 63 with different races. I also asked the company to analyze the lipids and produce, let me know how much lipids in each one. So you can see here for the cholesterol ranged from about 150 to 200. For triglycerides was from about 170 to 530. So it's huge. Some of the samples have huge quantity of triglycerides. Let us see what this will affect the results. This is a preliminary result. I tried different extraction procedures. I select the most advanced extraction procedure that removing lipids. I tried solid phase extraction, protein resuscitation, supported liquid extraction, which is advanced than the liquid extraction, and also the hybrid stationary phase. And as my hypothesis was correct, the extraction or the amount extracted was in good matching with the actual amount present in the sample. This means the lipemic sample after extraction will have huge quantity of lipids comparing to the normal plasma. I have here one of the normal plasma, which is 10 lots of normal or regular plasma sample combined together. So from these results, I found that even investigation of lipemic sample, not in the guidelines, you have to investigate it because you know it may cause problem. Lipemia may appear just after eating. So when you apply your method in the regular clear plasma, and then after that you have a patient with lipemia, how you can trust your results? Most of the bioanalytical method applied for pharmacokinetics study, for determination of the dose, for determination of absorption, excretion, whatever. So how you can trust your results? And you know that the patient are variables, and there is many factors may affect your results, even you using the method of choice as the worldwide say. Okay?
Asma.
So in conclusion, advanced techniques or technology do not
That's
guarantee the confidence. You have to be confident your results your way. Guidelines, it's okay, it's very nice to follow the guidelines, but also maybe something not in the guidelines yet. The easy option isn't always the best. Maybe you will follow with your research and you will stop at the end. The easy option isn't always right. It's not right. Even as I said, it's not like in guidelines. So, in conclusion, lipemic sample should be included during method development. Should be included, even it's not in the guidelines. I hope that FDA will add this point to the bioanalytical guidelines. As I said before, no need to see yourself as a lion in the mirror because we are working on research, not at home. So you may have a pretty face like this one, and it's better to see your actual face or your actual research results phase. Okay? Thank you so much, and I will be happy to answer any questions.
هو عادة بالنسبة لللايكوجرام باترن اللي احنا بنيجي نعمله، احنا بنسأل البيشنت أو الأنيمالز بحوالي 13 ساعة فصل. ففي الحالة اللي زي دي بتبقى الليفل نزل إلى أقل أدنى ليفل ممكن إن احنا نشوفه، وبعدين بعد كده بتبقى الريزلتس احنا taken to be as a correct and true and not false at all. So what is your conclusion about this fact, about fasting of the animals or fasting of the human 13 hours before taking any blood sample for lipogram pattern determination?
This is because you check one of the like lipid lowering compound or something like that. What is the experiment? What is your concern?
Whatever. يعني so to get a true results about the lipogram pattern or lipogram view of the patient, to ask him to just to fast for 13 hours, and this is already applicable to the animal cell. And then to give good result and to get your correlation between the markers and so on. So according to this will not be valid.
Yeah, exactly. It's better to get idea about the lipid content, and it depends, of course, on the method you use for the determination. Like if you working in LCMS, you should look at the lipids. My conclusion. If you look at other kind of techniques used for determination, it's better. Till now, this is why I got this conclusion. No one will check the lipid profile of the patient, of the volunteers, or of the animal. If you are not working on the lipid lowering, or you are working on hypertensive drug or hypoglycemic drug, whatever. So till now, there is nothing saying that is you have to check the lipid profile of your patient, and this is why. Even this is true about the manufacturer or the company collecting plasma sample. They exclude just the lipemic sample, and usually bring you like plasma which is clear and yellow and everything is correct.
What do you mean by the company? This is a company that
When I order plasma,
standardize the plasma.
No, I purchased such plasma because I'm not sure what is in Egypt, but in USA you cannot use any plasma or blood product without
Whatever serum.
Yeah, exactly. Whatever blood product, you have to order it. You have to purchase it from a company trusted that is there is no infection and everything is correct. You know. So this is the regular way. I never ordered plasma in Egypt. By the way, I'm not sure what is the right way to do it. But in USA, you have to purchase plasma from certain companies. So this company usually excludes the lipemic sample. And if they bring one sample lipemic for me, usually the researcher do not use it. But this is wrong because this is normal. One of your patients maybe have this lipemia, and this is you have to investigate this in your results.
Thank you.
Any more questions? Okay, thank you. So we will go to the. Our next speaker, Dr. Hind Kusaya, will give us some hope about breast cancer therapy.